Hi everybody, it's Dr. Chi. Welcome to part 2 of DUPUYTRE'Ns CONTRACTURE. Today we'll be talking about the surgical treatment of DUPUYTRE'Ns. Well, DUPUYTRE'Ns contracture surgery involves anesthesia, which means you actually go to sleep for the surgery. We make an incision, like a zigzag incision, just like what I drew right here, over the DUPUYTRE'Ns cord. Through that incision, meticulous dissection is needed to free up the DUPUYTRE'Ns cord from the underlying nerve arteries. Because the DUPUYTRE'Ns contracture, they usually wrap around your nerve and artery and tendon. It makes it very, very difficult to take it out. And this surgery usually takes a while. I can average anywhere between 90 minutes to about 2 to 3 hours. However, all the surgery is done under anesthesia, so the patient won't feel any pain or discomfort. As hand surgeons, we actually wear a operating microscope. It's called loupes. They are 4.5 times magnification. That allows us to get a very good visualization on the DUPUYTRE'Ns cord and nerve and artery. These are among the more delicate, refined procedures in hand surgery because of the fact that we need to really isolate and protect those nerve and arteries while taking out as much of DUPUYTRE'Ns tissue as possible. There is a direct correlation between how thorough the DUPUYTRE'Ns surgery is and what the recurrence rate is. So that means the more you can take out or more thorough the surgery is, the less likely a patient will experience recurrence. So what are some of the risks of this type of DUPUYTRE'Ns surgery? Again, as I mentioned earlier, the cords are very, very tightly stuck to the nerve and artery. So if, say, a nerve is cut or injured, you are going to have a loose sensation over one side or both sides of the finger. If an artery is injured, you can lose blood supply to that finger. Worst case scenario, if this is done by someone who is not familiar with the anatomy, or this is done with a very high risk, which means, it could be the finger's been operated many times before, and the nerve and artery anatomy is changed. If you injure both of the digital arteries, that finger can actually become non-viable. So it's extremely crucial to have the DUPUYTRE'Ns surgery done by a board-certified hand microsurgeon. So any other surgeries, maybe the general orthopedics can do, but DUPUYTRE'Ns surgery is not one of them. That has to be done by a board-certified hand microsurgeon. They have to be doing this quite a bit and very familiar with the DUPUYTRE'Ns contracture and its anatomy. So what is the recovery like with after DUPUYTRE'Ns contracture surgery? Well, the surgery is actually the most difficult part, and the good news is the recovery is actually not very extensive. Usually this type of zigzag incision heals within about 2 to 3 weeks. For people with severe DUPUYTRE'Ns contracture, I actually recommend the patient to start therapy even just after 1 week, even when the stitches are in place. So you can start movement and start range of motion. At 2 or 2.5 weeks, we'll take the stitches out, then patient can pretty much get back to normal activities. So in a sense, the recovery from DUPUYTRE'Ns contracture surgery is actually pretty short. So once we do the surgery and your finger is improved, does it ever come back? The question is not a straight yes or no. By definition, the recurrence of DUPUYTRE'Ns contracture is never zero because this type of abnormal tissue is in every single cell, and there's no way that we can get rid of every single cell that has this Dupuytren's disease. Now, the more thorough we can get the Dupuytren's cord out, and also the earlier we can intervene, the likelihood of clinical recurrence is lower. For example, if someone has Dupuytren's contracture as bad as this one, the likelihood of complete correction is very low. We can maybe get a partial correction at the best. If someone with a milder Dupuytren's contracture came for surgical help earlier, we can pretty much give them a full correction, get as much of Dupuytren's contracture out, therefore to decrease the risk of recurrence and subsequent surgery. So in my opinion, the clinical recurrence, which needs subsequent surgery, is pretty low, but we do encourage patients to come seek help as soon as possible. Remember that tabletop test. As soon as you cannot flatten your hand, you need to come see a hand surgeon. This is the end of the two-part series of Dupuytren's contracture. Make sure to subscribe to our YouTube channel, follow us on social media, and visit us at ochandsurgery.com. See you next time.